I'd like to speak with Chairman Ford.
Yes, sir, Representative.
You said that the MCO's profits are kept in check. How are they kept in check with the 9%?
Through targeted requirements that your medical spend,
Does that include the PBM's profits?
that they,
Does
They-
that include the PBM's profits?
it does include payments to PBMs that are separate from the MCOs.
Who's auditing the PBMs? Why do we not have actual data that we were supposed to get last year?
The legislature passed legislation last year, or actually the year before last, I believe, maybe even 16, putting the Department of Insurance as the regulator for the PBMs. I believe that the cabinet spoke to this body in November and said that the data that they had received wasn't what they needed and that they were sending a new request out, and that data is currently being provided by the MCOs as the department testified.
So you operate on a 9% profit margin. Is that what you're saying?
No, sir. We operate with a targeted margin of 1%. That 1% is to maintain the stability and financial viability of the company.
Okay, so a positive profit margin. How are these independent
At times,
pharmacies?
sir.
How are these independent pharmacies supposed to keep their doors open when you're underpaying them
And the
continuously?
And the legislature did pass legislation last year, I believe, that imposed a $2 increase in the reimbursement per script dispensing fee.
They shouldn't even need the $2 increase because they should be paid appropriately for the cost of the medication to begin with. Where are those numbers coming from on how they're reimbursed?
Representative Goforth, I believe that a pharmacy discussion, as we've had many times here, is worthy of a committee in and of itself. We could spend a half a day speaking pharmacy reimbursement.
I believe
But
we could
I hear
spend-
you, sir.
I'm extremely displeased that we still do not have those numbers, accurate data. Senator Wise has been working on that for several years that I know of, and you still continuously underpay these pharmacies below ingredient cost. We're not even talking about dispensing fee. I'm talking about below the ingredient cost. Why? How can they operate? You're operating on a positive profit margin.
Representative Goforth, your question would be better posed to the PBMs,
But
which
you
are
contract
separate-
with them, right?
which are separate and independent.
Does the state separate and independently contract through to the PBM, or it goes through the MCO?
They're subcontractors in all of our
From the MCO.
and all of our vendors.
From the MCO.
Contracts are reviewed by DMS.
So each MCO contracts with the PBM, or the state does it.
It's left to the individual MCOs.
Right. So then that's why I need to speak with you. You all need to answer the questions for who you subcontract the work to, right?
And
It's taxpayer dollars.
Yes, sir.
And it should be clear and transparent.
And I agree 100%.
So when are we going to get that data?
Sir, we have supplied the data. I
When are-
believe that it's currently at
Being looked
DMS.
Okay. All right. Thank you very much.
Thank you,
Thank
sir.
you, Mr. Chairman.
Thank you, Representative.